So the adverse effects for BTKis, although in this study we didn't exactly look at specific adverse effects, however, most importantly, depends on what BTKis you are talking for. So Ibrutinib, most important adverse side effects were the atrial fibrillation, which is seen in about 10 to 15% of patients. Coagulation abnormalities such as bleeding can be seen as well. So those are the main adverse side effects that led to treatment discontinuation for our patients. So if a patient has a predetermined or any risk factors for coronary artery disease, patient had atrial fibrillation before commencing the treatment of Ibrutinib, so I would not select such patients for Ibrutinib therapy. And some patients do indeed have like atrial fibrillation for a short period of time, not chronic atrial fibrillation, that can be managed by anticoagulation and the rate or rhythm control. So in that setting that we call paroxysmal atrial fibrillation, that we don't necessarily have to discontinue treatment, but mostly atrial fibrillation or bleeding abnormalities are the main problems that leads to discontinuation of BTK inhibitors.